Previously, she only had a GFR of 28, and every day was a battle with anxiety about her kidney disease. Everything seemed so difficult, but she didn't give up. She turned to the PureNutrition channel, where she learned how to change her lifestyle and diet in a natural and effective way. She started with small steps, drinking enough water, eating fresh, clean foods, and adding kidney-supporting herbs. She persevered every day, never skipping a workout, never forgetting to take care of herself. 3 months passed, and her GFR had risen to 57, a result she never dared to dream of. Her persistence, determination, and trust in the power of nature helped her overcome the disease. She felt not only healthier but also filled with hope for the future. So first, let's focus on how a CKD patient was able to increase her GFR from 28 to 57 in just 3 months. Was it a clinic error? Was it a machine malfunction? No. It was all due to her hard work and determination to change her lifestyle and diet. Now, let's look at how her treatment worked. The challenge is something called drug reconciliation, which is just a fancy way of saying I have to double-check that none of the medications she's been prescribed are harming her kidneys. So, it's like trying to solve a jigsaw puzzle where half of the pieces are shaped like drugs and the other half are shaped like insurance bills. Unfortunately, she's not taking any clearly harmful drugs, like proton pump inhibitors like Prilosec or worse, NSAIDs like ibuprofen or aspirin. However, there is one thing in her medication list that's concerning. In fact, she's taking Atenolol, or Atenolol, 100 mg daily, which is a high dose. Now, this blood pressure medication is quite common. Atenolol is a beta blocker often prescribed along with other blood pressure medications, especially when patients have high blood pressure due to stress or when there are heart issues. However, Atenolol comes with a risk, because you see, this medication is processed by the kidneys, meaning that when kidney function decreases, the dosage needs to be adjusted. She's taking 100 mg daily, and that's double the maximum dose, unsafe. Now, telling someone that a medication their doctor prescribed is harming their kidneys is a big issue. But you see, there is quite a long list of medications that need to be adjusted as CKD progresses. In fact, I can't let a patient take the wrong dosage and do nothing about it. Remember, the kidneys filter all the toxins in your body, and medications are always one of the biggest issues here. Are you taking any medications that harm your kidneys? There's a long list of drugs that need adjustment as CKD progresses. If we look at this list, we can see that many blood pressure medications need to be adjusted if your GFR is below 50. Blood pressure medications like amlodipine, Atenolol, and some diuretics like spironolactone are also on that list. Similarly, some statins like levastatin and many others are included. Diabetic patients also need to be monitored because medications like metformin and others need to be adjusted. There is also a long list of medications that are not commonly used, such as antibiotics and NSAIDs, that also need to be adjusted. Of course, this list does not include everything you should not take if you have CKD. These are just medications that your doctor should reduce the dose of when kidney function decreases. This is important because trying to improve kidney function while taking medications that harm the kidneys is like trying to fix a leaking roof while someone is drilling holes in it from the other side. It's not really conducive to progress. All of this may sound complicated, but dealing with CKD is complicated. If you would like me to review your medications and create a personalized treatment plan for you, please let me know in the comments. I'm here to help. People who are knowledgeable about their health and determined to make positive changes. With this guidance, they are taking their health to new heights. Speaking of personalized plans, there is something special I want to show you about her treatment. She has gout, which is caused by high uric acid levels. There is a medication for that, allopurinol, that is very effective, but like many other medications, it is also processed by the kidneys. So, she has been taking a lower dose. First, through a better diet, more on that later. But I also advised her to use a few detoxifiers to lower her uric acid levels. So the question is, what really works to keep uric acid levels low? First, you want to use cherry extract. Cherries are the #1 enemy of gout, according to science, because they contain a combination of anthocyanins and other flavonoids known to inhibit xanthine oxidase. Xanthine is the enzyme responsible for producing uric acid. Cherry extract also enhances uric acid excretion through the kidneys. This is a real detoxifier. This brings a powerful result. Studies show that combining cherries in any form with allopurinol reduces gout attacks by up to 75%. That's why taking about 400 milligrams of 10:1 cherry extract daily with meals is recommended. This supplement is also known to be safe for CKD patients. If you have gout, you should also understand that it is an inflammatory condition. This means you can benefit from some natural anti-inflammatory medications. Omega-3 supplementation is the first thing I recommend here. Also, without a doubt, antioxidant therapy is what really helps with gout and CKD in general. Therefore, antioxidants may be effective for this patient. Now, when talking about antioxidants, what's really important is to get as much as possible from as many different sources as possible. When we talk about chronic inflammation, we need to understand that this is a serious issue for CKD patients. It can really be life-threatening in extreme cases, especially if the cause of the inflammation is not addressed properly. Long-lasting low-grade fever and unwanted weight loss. These are symptoms of prolonged inflammation, which in some cases can lead to rapid kidney dysfunction. In fact, it's clear that you can't achieve better kidney function without reducing inflammation first. Are you experiencing inflammation? There are several symptoms you should watch for. Some common signs and symptoms of inflammation that you should monitor include prolonged low-grade fever. This is always one of the biggest red flags for inflammation. Joint or muscle pain. Remember that inflammation often causes pain. Swollen joints are also another common sign of inflammation. Fatigue, loss of appetite, and headaches are also common symptoms. Now, if we look at the symptoms on the screen, some might think it looks like the flu, right? Because the flu causes a lot of inflammation in the body. But that's acute, not chronic. So, if you have flu-like symptoms that don't go away, get checked. No, not to check for the flu, check your C-reactive protein, serum albumin, and ferritin levels. These levels can tell your doctor if you're experiencing chronic inflammation. CRP is our marker here, but low serum albumin with high ferritin is also a strong indicator of chronic inflammation. In fact, get checked even if you don't have symptoms. Many CKD patients have what's called hidden inflammation, which can only be detected through lab markers. It's still worth investigating because inflammation causes rapid kidney damage. So, this patient is at risk of losing kidney function quickly. Let's talk about our main weapon against the progression of kidney disease and inflammation. Who knows what that is? Yes, the answer is a plant-based, low-protein diet for the kidneys. Speaking of kidney diets. But if you think an improvement in GFR from 28 to 57 in a CKD patient is possible without a low-protein plant-based diet, prove it. Really, if someone can prove this improvement can happen without the diet, go ahead. Anyway, we still haven't found a cure for CKD that doesn't require a diet. The best we have today is a kidney-friendly diet, especially if it's well designed. In this patient's case, reduce protein intake and increase calorie intake. How do we do that? Now, when most people think of the concept of a diet, they associate it with weight loss. But if someone is already thin and needs to start a diet, can I recommend they eat cakes, cookies, chips, and soda every day until they reach a proper body weight? Cakes are not good for the kidneys, chips are very inflammatory, soda is full of phosphorus, and cookies, actually, you can eat cookies for kidney patients if you can find them. They really made cookies for kidney patients, but they charge you about €14 per box plus shipping. So, your new weight gain diet will be quite expensive. So, what foods can I recommend for a kidney patient that are low in protein but high in calories? First, I'd recommend using olive oil. If you need to maintain body weight and fight inflammation, nothing is better than olive oil. First, olive oil is one of the most powerful anti-inflammatory substances you can add to your dishes. Research has shown that a dose of 50 grams, or 4 tablespoons, of pure olive oil daily reduces pain by 10% compared to a daily dose of ibuprofen, but with 0% of the kidney harm caused by ibuprofen. In fact, olive oil is so powerful at fighting inflammation that it's considered one of the main reasons the Mediterranean diet is so good for you. And remember, olive oil is completely free of protein. This is extremely important for us because if the goal is to increase calorie intake and reduce protein, this food is your best friend. Of course, there are other oils with kidney protective properties, like avocado oil, flaxseed oil, and coconut oil. Another thing that might help here is seeds, especially flax seeds. Now, although seeds have some protein, meaning you should eat them in moderation, these tiny seeds are still excellent at protecting the kidneys for those with inflammatory kidney disease. Studies show that flax seeds can improve GFR in many patients. This is why flax seeds are one of the most recommended seeds for kidney patients. It's also a good source of selenium, a mineral for kidney health. Flax seeds also contain significant amounts of vitamin B6, iron, and vitamin B1, not to mention omega-3s. Now, the main cause of inflammation is reduced calorie intake, so here's a list of other low-protein but high-calorie foods. Fatty fruits like avocado, coconut, and olives are excellent in this case. Peanut butter, like almond butter, peanut butter, or cashew butter, is also very calorie-dense, though it does contain some protein. But trust me, just eating oil and flax seeds will quickly become boring. And of course, the main food when it comes to getting more calories without too much protein is white rice. I know, many people don't like when I talk about white rice. But you see, white rice has a unique benefit: it has less protein per 100 grams than most other staple foods. Now, folks, if you want to learn more about how to get more calories without increasing protein. That's all for today. Thank you for watching the video. Please subscribe and like this video.